I think they've been, okay. All right, good afternoon, everyone. Good afternoon, good morning, good evening, wherever you're joining us from. Thank you very much for joining this session. We have our facilitators on the call already. They are ready to provide you with so much value. So before we go into the session proper, allow me to first of all welcome you to this session. Thank you for joining us. We'd love to know where you're joining from, so please let us know in the comment below. Let's know the city. Type in the comments. Let's know the city you're joining from. You just put your city and what you hope to gain from this session. What do you hope to take away from this session? Put your city and what you hope to gain or take away from this session today. So I'll be looking through the comments. I want to see your messages. Drop your messages on the comment. Let's know where you're joining from and what you hope to take away from this session. So I'm going into the comment now to look at where you're joining from. Okay, I see Michael from Zimbabwe. Thank you for joining us, Michael. We have people from all over Africa. Emmanuel from Ghana, Michael from Ghana, Ashesi, Ew from Addis Ababa. Thank you. Douglas from Ghana. Thank you for joining us. I think we also have people from India as well. Wonderful, wonderful. It's a full house. Thank you so much for joining us this afternoon, evening, morning, depending on where you're joining from. So we have Dr. Ekundayo Shitu on the call. Dr. Ekundayo is the professor and chair of the Department of Engineering Management and Systems Engineering, George Washington University School of Engineering and Applied Science. Dr. Shitu is a professor and chair of the Department of Engineering Management and Systems Engineering at GW School of Engineering and Applied Science. It directs the Systems Modeling Laboratory for Economic Decisions, where it teams up with students and collaborators to study and build the strategic interactions between firms, technology stocks, and the external environment. Thank you very much for joining us today, Dr. Ekundayo Shitu. Also on the call, we have Catherine Huggins. Catherine is the Associate Director, Admissions and International Partnerships. Catherine has over 7 years of experience in graduate admissions. She specializes in international recruitment and partnership building. And she has served as the Assistant Director of International Graduate Admission. So Catherine would touch more on admissions and the programs offered by George Washington's School of Engineering and Applied Sciences. Right now, I will be sharing a poll. I'll be doing a poll. I want to hear from you. We want you to take part in the poll. Just a minute. So we'll put the poll up before we allow Dr. Shitu to make the presentation. Okay, so the poll is up now. So I want you to answer that poll. Let's find out your answers to that poll. What is the major consequence of inefficient medical equipment management in hospitals? So choose one of the choices there on your screen. So let's participate. We want everyone to take part in this poll. And after the poll, we would open the floor for Dr. Shitu to take us on this wonderful masterclass. So is the poll done now? Have you done the poll? Let's know Let us know in the chat. Okay. All right. So 70.
All right. So, whilst we wait for Kayode to get back, 74% said increased operational cost and resource wastage is a major consequence of inefficient medical equipment. So it appears majority agree with the first answer, but then also we have 11% which says 11% of which says that improved patient outcome and faster treatment, and then 15% total is split between decreased hospital expenditure and then reduction in equipment maintenance. Over to you, Kayode.
Thank you very much, Jojo. So majority agrees that increased operations is the best option. So, so we'll open the floor now to Dr. Shitu to lead us into this masterclass session. Dr. Shitu, over to you, sir.
Thank you very much, Mr. Bass. It's always exciting having Seed Global on this event. Thanks for the wonderful introduction. I'm happy to see Ms. Kat Huggins. Hello, Kat, on this call. And I'm particularly excited to see Mr. Jojo as well. Good to see you, Mr. Jojo. I am here just to take you through, you know, an experiential process that we try to engage students in when they come to the George Washington University, especially the School of Engineering and Applied Science. So I'm going to share my screen to allow us to see what I intend to share today. I don't know how much of my screen you see or what to see on the screen. Can you confirm?
Yes, we can see your slides.
We can see just the slides and nothing else, right?
Yes, just the slides.
Okay. I want to make sure that everybody gets to see the writing. So I'm going to hide the floating panels and the controls just to make sure that I don't stand in the way of what I intend to present here. So as you can see here, I want to take you through a process that we tend to engage our students in when they come to GW. And in this process, especially this particular project that we titled Maturation of a Novel System for Asset-Agnostic Wireless Monitoring for Medical Equipment. That's a mouthful of a topic, but you're going to see why it's a mouthful in a second. And we said from basic research to addressing a market opportunity. One thing you're going to find when you come to the George Washington University is that we engage in basic research. But when you do just basic research without innovation, it's research that ends on the shelf. We talk about how your research should be impactful, making change in the community. And by the way, your research can also lead you to making money, which is a market opportunity here. So my name is Ekundayo Shitu. I'm a professor of engineering management and systems engineering here at the George Washington University. And this is a project with, believe it or not, one of my former students who now has started a company that he calls Opal HTM. That's Opal Health Technology Management. And I'll tell you the story of how we got here. But to get us started, it's important we go through the 4 quadrants that make an exercise worthy of an exercise. What is the problem we're solving? Basically, how do we improve patient safety using Internet of Things technology? What's the potential for this technology to improve medical asset management, maintenance policies, and costs? Now, you'll be wondering, where did this question come from? As an academic, we write proposals, and the proposal we wrote was about how we can improve the patient safety. How can we make life better for a patient who probably is undergoing a medical procedure and a device fails? So think about that for a second. Here is the problem statement. What results are we looking at? So we end up with a wireless Internet of Things device that has all the characteristics of dual band communication, captures current, pressure, humidity, temperature, and even tracks the location of the asset. And we want all of this to be visible on a user-friendly dashboard. How does it solve the problem we identified? The monitoring of the equipment usage, location, and environmental data allows the manager to get deep insights into when maintenance should be conducted to reduce risk and improve patient safety, and of course, improve efficiency of the system. Of course, from this, how it solves the problem, you see the importance, because we're improving maintenance, procurement practices in healthcare. We're trying to reduce risk. So that's where we started from. We said we want to save lives, right? So square one, we began with the focus on patient safety. Why patient safety? In the US, as advanced as we are here, more than 50,000 serious and advanced sentinel events are caused annually in the US by faulty medical devices. By faulty, more than 50,000. At least 3,000 of these are fatal, meaning they lead to death. Then we said, what can we do? That's when we approach LMI. As you're going to find when you come to the George Washington University, we have a lot of consulting organizations. We have a lot of agencies that fund research. They come to us, engage with us to address problems that we have the skill set to solve. So we developed Patsters. They gave us some funding, about maybe $100,000 for a year, to kind of address this problem. So Patsters stands for Patient Safety Tracking and Monitoring System. As you can see from the acronym, Patsters, Patient Safety Tracking and Monitoring System. Now, the name is a little bit not accurate in the sense that we're not really tracking a patient. We're tracking the safety of the patient, okay? And it's an asset monitoring IoT, Internet of Things device that collects data to predict malfunctions and improve patient. So the first incarnation of this technology is what you see on the right here at the top right. You see, we started with Arduino, and then we went to a real circuit board, and you can see how bulky the first incarnation is. And below is the network representation of the deployment of this asset tracker at the top. With that stated, in research, we tend to look into the literature. And when you come to GW, either as a researcher, as a graduate student, the first thing you do before you engage in research is to say, what have others done? What is the state of knowledge? So we looked into the relevant literature, especially medical equipment maintenance literature. We looked at a guide to medical product development for service product managers. We looked into published papers, hundreds of them. And what we found, believe it or not, told us a different story. Medical equipment is often involved in patient incidents that resulted in serious injuries or death. So that we agree. Okay, medical equipment is often involved. That we agree. In fact, statistics accumulated by the Joint Commission. So for those who don't know much about how the US works, the Joint Commission is a regulatory agency that monitors hospitals and certifies that their biomedical assets, their machines, the technologies they use to deliver healthcare are in good condition. In fact, statistics accumulated by the Joint Commission show medical equipment-related sentinel events is typical among the top 10 types every year. Although the root cause analysis of these incidents show that most of them are not caused by equipment failures or maintenance omissions. Now you say, then what causes these failures? The primary causes are human factors, the people running the system. The primary causes are human factors, leadership, communication, and clinical assessment. Now, I'll take a pause at this point. We're saying here that these problems are not caused by equipment failures, but by human factors. But guess what? It is human factors that lead to equipment failures. If that is the case, then in what ways can we mitigate whatever the human factors are that lead to equipment failure by actually tracking the status of the equipment? That was all fine as a project. Then we discovered, yes, there's room for this. That was when we decided that, wait a minute, if there is no known technology in the marketplace that does this, can we actually define and begin to understand whether or not there's a potential market opportunity here? That's when we went to the National Science Foundation's Innovation Core Program. It's called I-Core Program. And in that program, they tell you, get out of the building. Get out of the building means I get to leave the confines of this office and I go talk to real people. We developed and tested hypotheses about the needs of end users and stakeholders. Because if you sit in this office, all I can get is what I see on Google and what I know. But if I go out of this office and I start talking to real people, what are the things I'm going to find? That's when we got out of the building. We got out of the building. We went to many hospitals. In fact, we covered 22 states of the 50 states in the US. We went to many hospitals talking to people in the medical industry. We talked to biomedical engineers. We talked to medical doctors. We talked to nurses. We kept talking to people. What are we talking to them about? We're trying to validate that there's an opportunity for our technology. And we even went to the foremost medical instrumentation conference in the United States. It's called the Association for the Advancement of Medical Instrumentation. That was in Texas. That's why you see me wearing the cowboy hat. We covered 22 states by getting out of the building. Remember, if I go back a few slides, one slide back, we got accepted into the National Science Foundation I-Core. This I-Core program gives you $50,000 to do nothing but just travel the country to validate your technology. And that's when we got out. We traveled. That's when I started working with Connor. You see in this picture, starting right here, on the leftmost here is Connor Roberts. That was my former master's degree graduate student. Actually, you get to see him in the third picture here as well. And we were together at this AMI conference, the Association for the Advancement of Medical Instrumentation. He was able to travel. He traveled more than I did. I probably went to 3 states. He went to the entire 22 states that were covered. We conducted interviews. We're talking to people. We're testing hypotheses. Remember, the process of conducting the interviews was such that we avoided confirmation bias. In other words, we never tell any of these people what we're working on. We just ask them, Mr. Abbas, can you tell us what your 9 to 5 looks like? 9 to 5 means from 9 a.m. to 5 p.m. What does your work day look like? Then Mr. Abbas, who is a biomedical engineer, will say, well, I come in the morning, I check all the machines, and I look at our schedule for machines that need to be maintained. We say, okay, then what do you do? Then I go into maintaining them. Then at 5 p.m., I go home. Then we ask Mr. Abbas, if you had 3 extra hours per day that you don't have to do that, what would you spend? Oh, Mr. Abbas will say, you know what? There's a training I ought to have gone for the past 5 years that I haven't been able to go for. As you can see in this figure, we interviewed across 22 states, equipment engineering managers, clinical engineers, equipment technicians, clinicians, the people that sell biomedical assets, technologies, and anybody that is willing to talk to us. What we found by talking to people, because we got out of the building, what we found by talking to people is, what does a day in the life of a biomedical engineer look like? Well, what you're looking at here is an ultrasound machine. A hospital may have hundreds of these machines. And in fact, we got to a hospital in Chicago that spanned a block, a complete block was the entire hospital. That hospital had 800 beds. Now, let's put it in context. The average bed in a hospital has got 13 medical devices on average. 13 medical devices. So if you have a small hospital that has 200 beds, multiply 200 by 13. Right there, you have 2,600 biomedical assets they have to maintain and manage. Now, imagine a hospital with 800 beds. Your guess is as good as mine. So what do? Preventative maintenance. In other words, they do preventive maintenance before it breaks based on the manufacturer's recommendation. They have this long list of checklist of items they go through, and then they do the actual testing. And of course, it also impacts the biomedical officials, the doctors, the nurses, because they are affiliated and associated with the use of these devices. So the question here is, new medical equipment maintenance standards require more hospital time, not only time, but also money. We all know time is money, and staff, because you need the staff to do what? To maintain the medical assets. So a day in the life of this guy is not something anybody likes. You see, he has to go through so many of these devices. That's why the challenges that we identified earlier are this staff are they are overworked because there are not many of them. Okay, typically 70 to 80% of desired staff level, meaning that many hospitals typically have just a 3/4 of what they need in terms of the staffing for the maintenance of the biomedical asset. And therefore, the people that are staffed are overworked. They make them work excessively. And as a result of being overstaffed, there are extended equipment downtimes, meaning that even when eventually equipment fail, they just push them out of service because they are yet to get to those equipment. And in many cases, they walk to the first solution, not the best solution. What that means is the moment an equipment breaks down and they maintain it and they figure that, oh, it's on, it's running, they push it back in operation. But does that mean that's the best solution? In many cases, it is not. You pay. These hospitals pay for expensive service contract. You know what happens? The manufacturers of these devices, they even give them to hospitals for free. They give it to them for free. You know, and where they make money, you'll be wondering, is in the service contract. Imagine you go to a car dealership and they give you a Mercedes-Benz for free. And they tell you, hey, it's all yours. But whenever you have to maintain it, bring it to us. That's where they make money with this asset. So hospitals are performing more maintenance than is necessary. They are overworked. Hospitals are under tremendous pressure to do more with less, to do more with less. And if that is the case, it's a crisis of excess because many of these hospitals also have bloated equipment inventories, inefficient maintenance, which is a major source of waste. So because we saw a market opportunity here from our interviews, we decided to estimate the value of that market opportunity. And the value is here. $93 billion is spent annually on biomedical equipment in the United States. 58% of them are staying idle, locked up in a store unutilized. 25% in some hospitals have excessive plant maintenance, meaning they are overdoing. Some assets do not even need to be maintained, but then they push them into maintenance. So you see the value here. Equipment managers are desperate to solve these challenges. But as you all know, in engineering management and systems engineering, we need data. In fact, in engineering in general, we need better data to make informed decisions. So this is where we come in, analyzing equipment usage. We're developing a system to track when, where, and how often medical equipment is used. Here is the latest incarnation of our technology. You can see before this screen gets plugged to the wall, it gets plugged to our technology, and then it gets plugged to the wall. So what you see here, this device has undergone at least 7 incarnations, iterations before it's this level. You saw the first incarnation in the first couple of slides. And what we're basically doing is, can we now associate this device with a dashboard? This dashboard is tracking several parameters on the usage of the asset that this device is connected to. So this device is our IoT, that's the Internet of Things device. And what you see here is it gives us analytics on the utilization, the level of reliability, the cost analysis of its survival rate, and the forecast of when we think this asset may actually fail. This is where what we call condition-based maintenance takes place. So all of a sudden, ladies and gentlemen, believe it or not, we're now making equipment to speak to us. For example, this ultrasound machine says, I've been operating for 5,000 hours. Isn't it time somebody inspected me? This one says, anybody there? I've been sitting in this closet. Remember, these devices are also like the cars we have. If you own a car and you park it in your garage without using it, come back 3 months' time, you'll be surprised to find that the car may not even start. The same thing with assets that are unutilized. So how do we create an equitable utilization of the asset hospitals have? All this magnetic resonance imaging machine, it says vibrating more than usual. I may need parts replaced. The only way these devices can talk to us is through what we have developed in terms of the Internet of Things technology. Then we marry this observation here, we marry them to the financial opportunity, the business opportunity. Infusion pumps, IV pumps are below 30% utilization. Maybe it's high time we sold our excess inventory. Only 2 of 3 ultrasound are used currently. Maybe we should reallocate the redundant equipment to another facility. The ventilator is 2,000 hours below expected usage. Maybe because it's 2,000 hours below expected, we may want to defer maintenance to the next quarter or maybe to the next month, for example. So what you find is that degradation in the use of these devices, they are caused by random processes due to gradual shocks or even due to what? Due to sudden drop of some of these devices. And what you find is what we started doing by collecting data. So what we're trying to do here on the right is we have the years in which the asset is in operation, and we have its capacity. Its capacity in here meaning, is it working at 100% capacity or less? That is what our device captures. So over time, we can trace how the asset degrades in capacity over time. And different assets have different thresholds. But not only do they have different thresholds of degradation, we're also saying that at what level of capacity do we maintain this asset? Do we push them for repairs, for services? Even if you say at 30% before the asset fails, the question is, which of these wavy degradations is the best approach? If you take the orange one we have now, that'll be too soon a replacement. If you take the green line we have here, that'll be too late. Of what? Of a maintenance policy. So we can collect this for several items and for several assets in the same category. And the black point you see here provides the average of all these assets. And then we see in most cases, the original equipment manufacturer, that's the OEM, the original equipment manufacturer recommends that assets should be maintained at 70% lower level of capacity. But we're saying, why maintain it? That's why those biomedical staff, they are overworked. We say the alternative equipment maintenance structure says, do it at level 2, period 2, which even pushes it out a little bit more. But we are saying, how should our solution spread out when this maintenance should take place in a situation we call just-in-time maintenance? That way, the biomedical technicians are not wasting their time over maintaining assets that do not need such level of maintenance. And that we call condition-based maintenance. Now, people have studied some of this. This is where you come in as an engineer, okay? You're gonna come in, collect this data, analyze the data, and identify those thresholds of when the asset ought to be maintained in real time, Now we're talking about the use of AI and machine learning algorithms. I just finished a project where we used an LSTM CNN-based model to predict when a battery should be recharged, lithium-ion batteries. And here you have another sample of a maintenance policy where you have shocks induced into the system, making their capacity drop abruptly, and they maintain that level of operation, and then we decide when the impulse control should lead to what? Should lead to the next maintenance cycle. All of this is fancy because we do research that has an impact. We don't do research just for the sake of publication. So we deployed our device in 2016. We deployed it for 3 months at GW Hospital. That is the level of access we have. We collected every 5 seconds. The device was collecting data on temperature, humidity, and pressure every 5 seconds. This is temperature data over a period of 3 months. If you look at what we have here, in this case, it's 10-second interval over a period of 3 months, 6,000 observations. Humidity is showing up here. Pressure is showing here because we recognize that these environmental factors and usage especially play a role in determining what the hotspots are for this biomedical asset. So we use our machine learning algorithm to identify those critical hotspots. One thing you see for an extended deployment of our technology is that these ovals, you see, these ovals that are making blink, these ovals that you see, those ovals get closer. As they get closer, that should signal an alarm to the biomedical engineer that this asset is at the point that it requires maintenance. So what's the impact? We allow hospitals to do more with less. 20%, 25% reduction in equipment inventory, 44% reduction in maintenance activity, which also reduces costs and improve patient safety and care. So at the end of the day, everybody is happy. The biomedical engineer is happy, the doctors are happy, the nurses are happy. $5 million savings annually on average per hospital. And that has a whopping $23 billion impact across all per year, $23 billion per year. That's probably bigger than some countries' annual budget. The point we're making is, when you come to GW, we not only take you through the technical aspect of the curriculum, we also show you the real world impact. So this project started in 2016. You can see that's myself and Connor making a presentation at LMI on the progress. LMI funded the first aspect of this research. Then we did the markets research and the pivoting. Remember, we started out with the intent of doing what? Saving lives. Then along the way, we said, wait a minute. Oh, who cares about saving lives? We can also make money in the process. Of course, we care about saving lives, but we can make money in the process, legitimate money. And then Opal. So the story about Connor Roberts, this student of mine, is phenomenal. He's a go-getter. He's just someone who is driven. And he decided, in fact, when he graduated with his master's degree, he got a fantastic job offer at Naval Research Labs. Okay, Naval Research Labs is a top research facility. He did the job there for 1 year and he quit. He quit to do what? To pursue this as a business. Today, he has a company that now has hired 3 of our former students. And then we're conducting an infusion pump study now. And the next chapter could be you. With the support of the AMI Foundation, we got about $100,000 from the Association for the Advancement of Medical Instrumentation to advance this technology. And now we're working with, believe it or not, nursing students. You'll be wondering, what is it that an engineer has to do with the School of Nursing? Well, because our work is related to biomedical stuff. So what did we do? Well, we are looking currently at the data collection efforts. We've been supported by George. That's the other thing about George Washington University. The Technology and Commercialization Office said, wow, these guys are onto something big. They gave us $50,000 to extend the technology. Next, we're interpreting the data we're collecting simultaneously. How are we doing this? There's a suite of funding from the National Science Foundation that we call SBIR, STTR, Small Business Innovation Research Funds, Small Technology Transfer Research Funds. We got $275,000 for 1 year, plus $100,000 provided by the Technology Commercialization Office. They call it a matching grant. Make sure you total this together. And finally, we're going to deploy. That is where we're in collaboration with 3 hospitals as I speak. That's where we got the Partnerships for Innovation funding, which is a little bit over $500,000 for a 3-year project. If you total this, that's almost $1 million within the span of 1 year for this company. So who are the people behind the scene? Here's our team. The first guy here is Sanchit Vijay. Sanchit Vijay worked on a DoD project with me during his master's degree program. And he stayed back to continue working on this project because it has become an opportunity that currently he works for Opal, the company that Connor runs. The next student you see here is Mobolaji Shobanke, a graduate from University of Lagos who came in for his master's degree, also worked on a DoD project with me, and now is actually continuing onto his PhD studies. He's at the end, approaching the end of his first year on his PhD, and is working on this technology with us. The first lady sitting there is Tabitha Northrop. Tabitha is a nursing student. And right in the middle is Connor Roberts, who is a CEO, MD of Opal HTM. Connor is the reason we're all in this picture, because he decided to pursue the innovation. Connor could be you tomorrow. Seated right next to Connor is Aisatu Thiam, who is also a nursing student. Standing behind Aisatu is Dr. Christel Farina, who was the director of the Simulation and Innovation Learning Center a year ago when we took this picture. And of course, that's myself, your humble guy here. So what are these people doing? The nursing students are meant to establish a comprehensive data set. They identify equipment operating modes, and they perform data collection at the Simulation and Innovation Learning Center, which is a simulation center that has mannequins as humans. I'm going to show you that in a second. Right here, the Cell Center. This is why you want to go to a world-class university. Here at GW, when you go to the Cell Center, a 20,000 square feet capacity, 20,000 square foot capacity. It has state-of-the-art. You think all these mannequins, they are not humans, but they are meant to be humans. This is how nurses are trained. Features high-fidelity human patient simulators. Simulate a variety of different healthcare scenarios. And then it allows the monitoring and communication of those with those in the simulated environment. And this accords the nursing students this first-hand experience of working as if they're working with real patients. This is as best, and these are mannequins that are responsive. They act like almost humans. So Sanchit Vijay is developing algorithms to translate the power measurement into data usage. In other words, he's trying to identify when is the equipment off, when is it in idle state, when is it active, when is it idle, when is it off, when does the cycle repeat? And all of these activities are done within the Cell Center, the Simulation and Innovation Learning Laboratories. Mobology is developing user-informed management strategies. You can see how all of this add together to inform the technology we're developing. Ladies and gentlemen, what more can I say? Your work will help make healthcare safer, smarter, and more efficient. While this is a healthcare project, we have projects in the energy realm, energy technology. We have projects that are related to informing policy. Is it climate change policy, environmental policy? We're informing policy. We have research that is helping utilities make decisions on what technologies they should be making investments into. We have a whole spectrum of real-world, innovative research exercises. So, what are you waiting for? We'll be looking forward to seeing you join the George Washington University. Thank you very much.
Thank you very, very much, Dr. Shitu. That was an amazing session. Thank you so much. I'm sure a lot of you gained a lot from that session, and I'm sure you have so much questions. I myself, I have a lot of questions to ask Doctor, but I'll ask in private. But if you have questions based on the masterclass, I'm seeing a lot of questions outside of the masterclass, but if you have questions for Doctor, please put them in the question and answer box. We are going to attend to those questions. So I'm sure you've heard a lot about why you need to attend a world-class university like George Washington School of Engineering and Applied Sciences. And so I'm going to let Catherine Huggins speak on introduction to George Washington's programs. Catherine, take it away. Over to you.
Yeah, thank you, Coyote, and thank you, Dr. Shitu, for such an amazing presentation. It's always fascinating to hear about the work that you're doing with your students, the research, and the different ways that you're collaborating with the other hard sciences on campus. We love to hear that. As you know, our dean always likes to talk about engineering and so this was wonderful to hear about. But I'm going to quickly talk a little bit about our graduate programs. The admissions requirements, funding information, things like that. I'm going to try and be quick about it so that we can get to those questions that I know all of you are burning to ask. So just bear with me as we talk briefly. So we're going to talk a little bit about what to consider when you're thinking about applying to graduate schools, what we think are important considerations for you to be looking at, including the location of the university you're applying to, what facilities are being offered, what resources is the university providing, what does the, career services and alumni network look like. But really, it's about finding the program that is the best fit for you. So obviously, a lot of students think about rankings, they think about looking for that information first, but that's just a starting off point. These types of questions that we're going to be going over are really the things that are going to shape what graduate program is going to be the best fit for your interest specifically, because this is really going to be a highly specialized degree that you're going to be pursuing. A master's program especially is only about 1 to 2 years in length, depending on the school you go to. So making sure it's exactly what you want is going to be the best option for you. So to talk really briefly about George Washington University, we were founded in 1821 by an act of Congress. And we are unique in that we're predominantly a graduate institution. So we have about 10,000 students sitting at the bachelor's level, but we have about 15,000 students sitting at the master's and PhD. Our main campus is in Washington, D.C., which is the capital of the United States. And we are located in the neighborhood of Foggy Bottom. That's right downtown. We're about 5 blocks away from the National Mall, 2 blocks away from the World Bank and the IMF and other large international organizations. But we also have 2 other campuses spread throughout the area. We have the Mount Vernon campus in Georgetown, which has some athletic fields that students can access. And we have the Virginia Research and Technology Center out in Dulles, Virginia, near the airport. And we have shuttles that go between all 3 of these campuses. And then, of course, along with the School of Engineering and Applied Science, we do have 14 colleges and schools within GW. So you already heard Dr. Shitu talk a little bit about the School of Nursing, the School of Medicine and Health Sciences. We also have the School of Business, the Columbia College of Arts and Sciences, and many more. But of course, we're here with the School of Engineering and Applied Science. You can see a lovely photo of Dr. Shitu teaching class right here. We are made up of 6 academic departments. So within those 6 academic departments, we do offer 11 different fields of study, and those academic departments include biomedical engineering, civil and environmental engineering, computer science, electrical and computer engineering, mechanical and aerospace engineering, and of course, engineering management and systems engineering. We do have 80 tenured and tenure track faculty members throughout these academic departments, and they're all highly dedicated to pursuing research and working with our students in that regard. So obviously our research spending is pretty high in that regard. And we are proud actually that the university recently joined the American Association of Universities, the AAU. We are one of the 71 schools invited to this top research organization for dedicated institutions doing top research in that regard. So it's something that we're pretty proud of. It's only invite only, and it's definitely reflecting the work that's happening on our campus right now. Now, our main building is the Science and Engineering Hall that's in that Foggy Bottom neighborhood that I mentioned. This building is LEED Gold certified, and it's where the majority of our students would consider their home base if they come to join the School of Engineering. This is where we have the majority of our classes. This is where our faculty have their offices. This is where our administrative offices are for this admissions office or career services and things of that sort. It's also where we have a lot of our different research and lab spaces. So we have a class 100 nanofabrication clean room. We have a high bay with a strong wall and a strong floor. We have some high resolution imaging suites and much more, including some collaborative research spaces that we share with some other hard sciences on campus. So I know that the School of Medicine has a cancer research institute on the top floor and some other research going on within this building. But if you come to GW as an engineering student, you'll probably spend a lot of your time within this building, not just in those classes and things, but also just spending time with your friends, studying, meeting up with each other between classes and things of that sort. Now, the master's programs that we offer, you can see the list right here. Our master's programs at GW Engineering are going to be typically 2 years in length. They range from 30 to 36 credit hours, depending on the program you enroll in and whether or not you choose to pursue a thesis. The majority of these courses are going to be thesis optional, meaning it's up to you to decide whether or not you want to do that research or if you want to just pursue coursework instead. And then our PhD programs, we don't offer them in all of the same areas, but you can see this list right here. PhDs are going to typically be 4 to 6 years in length, and that discrepancy is going to be dependent on whether or not you're entering with a prior master's degree. So if you do, then it'll probably be more like 4 to 5 years to complete that PhD. If you do not have a master's, but you know you want to do a PhD, you are allowed to apply direct entry. And if admitted, that would be more like 5 to 6 years to complete because there's a higher threshold of credits you need to complete before you begin your dissertation. Now, in terms of scholarships and funding opportunities, we do offer merit scholarships at the master's level. Those range between 25 to 75%. So you see we have 4 different percentages that we offer. There's no separate application. If you apply for admission to the university, you will be considered for one of these 4 scholarships. And if you apply through the Seed Scholarship Fund, you'll be given additional consideration for one of these scholarships. So you'll be being reviewed in a smaller pool of applicants for a number of these scholarships that we've set aside specifically for Seed applicants. You do, of course, need to apply both to Seed and GW Engineering to get that additional consideration. And I know Coyote has already mentioned that the round 4 app deadline is coming up. So feel free to work on that quickly to get that in. We are actively reviewing applications for master's admissions right now and sending out decisions as we speak. For doctoral funding, that's going to look more like that typical full funding offer that you might be more familiar with. This is when students receive full tuition coverage with a monthly stipend and living expenses, depending on the assistantship they're offered, whether it's a graduate or a teaching or a research assistantship. The thing to keep in mind about PhD is that those deadlines are very strict. So unfortunately, we are no longer accepting PhD applications for this fall. That deadline was January 15th. But we will accept applications for future semesters. So if you're interested in next spring, that deadline will be September 1st. And if you're interested in fall 2026, that deadline will be next January 15th. So getting those applications in on time so that the faculty can review you and potentially offer admission is really important. And then just to leave you with a little bit more information, of course, we have our W. Scott Amy Career Services Center. That is a resource for any admitted or enrolled student at GW Engineering. They'll help you with building your resume, preparing you for job interviews. If you get a job offer, they'll help with salary negotiation and CPT and OPT support as well. And then, of course, our location in Washington, D.C. offers a lot of different advantages, but greatly one of those is going to be that relationship that our career services has with a lot of the longstanding industry leaders within the DC area. And our faculty as well have relationships with those organizations and companies. So you really do benefit not only from the small class sizes, because we have about 1,100 students sitting at the graduate level at GW Engineering, but also physically from our location and the close relationships that our faculty and staff have generated with those professionals in the area. And then I just want to make sure that you all know that you are able to connect directly with a graduate ambassador if you visit our website. We have 8 grad ambassadors, but these are just 3 of our examples. So you can actually directly message them, ask them questions about their experience applying to GW, about being a student, what it's like to pursue a PhD or a master's or anything of that sort. But now I tried to get through that as quickly as possible. That's the end of my presentation. Of course, for attending today's session, you do all qualify now for an application fee waiver. That is Seed MC 2025. So at the end of the application, if you select request a waiver in the payment option, a text box will appear and you'll have the option to type in Seed MC 2025 and somebody from my team will manually approve that within 1 to 2 days. But that is the end of my presentation. So happy to pass it back to Coyote so that we can answer questions, and maybe Dr. Shitu as well.
Speaking of the seeds scholarship to GW. We are offering not one, not two, but 19 awards covering up to 75% tuition. So you can apply with the link in the chat box. So just check the link in the chat box. There's a link that takes you straight to the SAFE Scholarship application portal where you can apply for any of the 19 awards and get shortlisted for those awards. Thank you very much for joining. So we are going to take questions now, but before then, I want to put up the second poll to find out your answers for this particular question. So the poll is up now. Please just answer the questions. Take the answer that you agree with. Which factor would most influence your decision to pursue an MS degree in the US? So let's take the poll right now, so we can move to the question and answer session. Okay, so we have our poll answers now. So 61% answered career advancement opportunities, 37% answered industry connections and networking, 32% said experiential learning and leadership opportunities, 13% said location and accessibility, and 9% said orders. These are very interesting answers. Kant, I hope you're taking, you can see, I mean, you're taking notes of this. Okay, so we'll move now to taking questions and answers. And we have two categories of questions. There are some questions specifically for Dr. Shitu. So we'll take that quickly before we then move to the questions for Catherine. So Doctor, I hope you're ready for us. So we have some questions around your presentation. So I'll answer them. I'll team them up together, questions that relate, and then ask one or two themed questions with all of the questions together. So there's a question around the IoT device and about how high voltage can cause those devices to malfunction. So the person asking this question, Otman, wants to know if the devices measure temperature, pressure, etc., and what parameters are being measured from the device and the surrounding of the device.
Very good question, Otman. One thing you find is that our device is meant not to interfere with whatever supplies the main equipment is getting from the wall, from the source. It doesn't interfere. All our device is doing is making sure that it captures whenever that asset is being utilized. Now, you are right that the voltage or the current that flows through our device into the medical equipment may be low or too high, but guess what? That's exactly what our device is to capture. Capture those instances when you have values that are spikes outside of the range or that are dimps lower than the range. So we capture those. And the question here is, in the absence of our device, there is no capturing of those until the biomedical asset fails. So the more we capture those outliers in the flows of current or voltage over the asset, the more we're able to tell about the condition of the asset. Now, is our device immune from those fluctuations? The answer is no, our device is not immune, but our device captures those fluctuations. Now, the corollary of your question is saying that, does it measure temperature, pressure? Yes, it does. These are sensors. We have sensors in that little device. about 15 sensors. There are sensors on vibration. And by the way, because it's charged, it's connected to the biomedical asset, charging takes place automatically as well. And by the way, even when the asset is one that is not being used by being plugged to the wall, so long as our device is within the confines of the asset, it captures all this environmental data. Maybe not the usage in terms of voltage, current, and water view, but the environmental data it captures. So those are done by sensors. That's what the device is all about.
Thank you very much, Doctor. So the second question is from Albert. So he's asking, what are the key challenges faced in real-world deployment of this system, and how do they impact performance?
Very good question. You know, that's where we started by saying, get out of the building. You know, we can sit in our labs, on our computers, writing fancy codes and, you know, fancy models and what have you. But until you go out to the real world, before you get to see what the challenges are. I'll give you an example. When we approached the sales center, that's the Simulation and Innovation Labs Learning Center in the School of Nursing, and we went in there, they gave us approval permission to even connect our laptop to the infusion pumps, took a lot of technical savviness. And that's where you see that, you know, it's not always a linear function. There are issues that come up that you just have to use your prior knowledge. And this is why the research aspect of this is very engaging. And to be honest with you, there are 1,001 problems that can come up. All we just have to do is using our intelligence to address those challenges. And some of them, we just can't address them for whatever reasons or challenges that there may be. But on average, we're able to deploy the device to collect data.
Thank you very much, Dr. Shitu. So I have a two-in-one question. So what is the interoperability feature factored into the device? And also, how can AI be integrated into this device?
Oh, let me start with the second question. There are so many opportunities for AI, you know, integration into the device. I mentioned, you know, integrating convoluted neural networks, some deep learning strategies on the data that we collect, okay? Those are the opportunities for AI. I talked about LSTMs and what have you. Those opportunities are there to dive deeper to understand the nuances that we ordinarily cannot see just by looking at the charts. Again, it's one factor to consider one variable, but we're talking about many variables here. And that is one room or one opportunity that, and AI will do that in a very fast way as well. Now, to your question about, you know, how the device is agnostic, you know, because look, at the end of the day, our device is agnostic to the parameters because your biomedical asset is being plugged to our device and is being plugged to the wall. Our device has got this self mechanism that allows it to say, what is the ambient that this biomedical asset operates in, and when do we see spikes that are outside of the ambient? If you've ever plot graphs, quality control chart graphs, like P chart, Q chart, and what have you, you have the range of operation. Once you get out of the upper range or lower range, you know that there are problems. And that is what our device does in terms of the usage. By the way, in terms of the usage, notice as well that we have a dashboard where we can enter the ID of the device and it will tell us all the information of the device up until that point in time. So if it's a device that is sitting in a closet, we also get to know that that device has not been used for the past 3 weeks. If it's a device that is constantly being utilized, the panel also tells us that. I'll give you a story. So when we deployed the device in the IoT device in our biomedical, in our hospital, which is just across the street here from the School of Engineering, when we deployed the device to collect data, we noticed in the process that the nurses, they have this affinity, I think it's just all humans, to using a particular ultrasound machine. They said, no, I want to use Zona Z1. Everybody wants to use Zona Z1. By the way, there are up to Z100 of those ultrasound machines. Why is that that affinity to that particular device. That we can capture from the dashboard, which monitors all of these devices. So again, the point here is when it comes to making those distinctions, the device is asset agnostic. That is the novel value contribution of the technology.
Thank you very much, Doctor. Thank you very, very much. Okay, so I'll now turn to Catherine with questions about admissions. So we have different category of questions. There are questions around preparing for a strong application, the usual, I mean, which you're certainly used to getting at this point. So questions around also studying, working while studying, then questions around career opportunities post-study, then questions around the scholarship and funding. So I'll allow you start with the just advice, give the candidates advice on how can they prepare for a strong application. What advice would you give them to be able to give a strong application to the program?
Yeah, definitely. So what I would say, of course, is that when you're preparing your application, making sure that you're following the application requirements, you're getting everything submitted that we are asking for in a timely fashion. But also making sure that you are paying paying good attention and putting effort into this application that you're submitting. There are certain things you can and cannot control. You can't go back in time and change the grades you got in your first semester of undergraduate study, but you can make sure that the faculty that you're asking to write your letters of recommendation are really going to advocate for you. You can make sure that that statement of purpose is something that you're putting effort in, that you're tailoring to our program and our university, that you're writing it in your own words and maybe not using ChatGPT as a crutch to write it for you. And that you're really highlighting what you've done outside of the classroom in that resume and CV. Those are going to be the things that are really going to help to make your application stand out when you submit those applications.
So it's the other category of questions we've got around working while studying. So what is the opportunity for someone studying at UW College School of Engineering, and do they get graduate assistantship positions as while doing their MSc?
Okay, so that's two different questions. So let me break it down. In terms of working off campus, as international students, you'll be studying on what's most likely known as an F1 non-immigrant student visa. So there are some restrictions in place as to when and where and how long you can work. During the first year of your program, you are allowed to work on campus in a student job. You can work in the library or the gym or an administrative office or something of that sort, but you don't have the option to work off campus yet because you're on a student visa. The US government wants to make sure that you're focused on your studies and succeeding. But after you've completed 1 year, so fall and spring or spring and fall, you are eligible to participate in CPT, curricular practical training. That's the status that allows students to actually go do an internship or a job off campus in their field of study at a company in DC or around the US if it's during the summer. And you have that freedom to get that hands-on experience. Obviously, our career services team is there to help you to find those opportunities. And even though you can't work off campus until that first year, you can certainly be engaging with the career services office during that first year to connect with companies, to strengthen your applications, to work on your interview skills, and things of that sort. In terms of graduate assistantships, those are typically going to be reserved for doctoral students at the point of admission. We don't often award those to master's students at the point of admission. That doesn't mean that master's students can't get an assistantship, but that typically wouldn't happen until you've been in the program for a little bit of time, maybe a year or so. You've developed a relationship with the faculty. They might make you aware of an opening in their lab or invite you to apply to be their TA or something of that sort. I certainly do know master's students who get an assistantship later, but it doesn't come at the point of admission. And I see Dr. Shitu nodding, so I think I'm speaking correctly on that fact.
Right. I mean, you're perfectly right, Kat. The truth is that I'll tell you this. In the summer of 2023, I worked with 8 master's degree students, eight of them, and they were all fully funded for those 3 months of the summer. And when I say fully funded, we're talking about $2,500 a month for 3 months. Then fast forward to the fall of the summer of 2024, I work with 6 master's degree students, and they were not only funded for the summer, they were funded from the beginning of May till the end of December. By my last count, each of them got $15,000. And as I'm talking to you, each of them has got a paper that either has been accepted or is under rounds of reviews based on the project that they worked on. So again, there are opportunities. It's a function of how driven are you as an individual? How motivated are you? How, how excited are you to work on projects? The story I told you about Connor, who runs this company I'm talking about, that much of the talk I presented is based on. Connor was an undergrad student here at GW in electrical engineering. And he knocked on my door on a morning in January 2015 or 2016. He knocked on the door and I said, hey, what can I do for you? And he said, Professor Shitu, I want to do research with you. And I said, dude, I don't even know you. And then he introduced himself. He tells me his background, and then he left my office. As he was leaving, I had already received the funding for this project that I described to you guys a few minutes ago. Then I said, you know what? My initial intent on the project, believe it or not, was just to buy finished sensors, assemble them, and deploy to collect data. I gave Connor the 3-page proposal that led to the funding. He went, came back the next day and said, Professor Shitu, we're not going to buy these sensors. We're going to build this thing in-house. And I said, hey, this is a guy I'm looking for. And that's how the partnership started from 2016 till date. The point I'm making is you have to be driven. You have to have something you bring to the table. And you have to be willing to knock on doors, talk to professors, show them your expertise. Who knows? There may be a project lying on the table that you could be asked to execute.
Thank you very much, Doctor. Thank you, Catherine. So I'd like us to also quickly touch on postmasters opportunities, career opportunities. What are the opportunities available, and what support is available for international students post-masters? Catherine.
Sorry, I thought you cut out for a second there. Obviously, as I spoke, we do have our W. Scott Amy Career Services Center that's located right on the 2nd floor of the Science and Engineering Hall. That is a dedicated career services resource just for the School of Engineering. The university as a whole has a university-wide career services office, so you actually have 2 different resources that you can take advantage of. Our team, of course, just has a little bit more knowledge and networking availability within the fields of engineering and applied science. They're just a little bit more involved in those areas. So they're probably going to be a better resource for you in that regard, but we encourage you to take advantage of all of those resources. They will bring companies to campus to invite you to attend networking events. They'll have interviews sometimes being held on campus that you'll have the opportunity to participate in. I know they've brought Dell to campus before to do interviews. They'll also do career fairs sometimes. Sometimes they'll even hold specific ones just for international students so that you know the companies attending are looking to hire international students, are already familiar with CPT and OPT regulations, things of that sort. What I will say about career services in the United States is it's going to be very different from potentially your experience in your home country. I know India has placement where the university will guarantee you a placement and are secured at a specific company. The United States doesn't do that. Our career services office is there as a resource for you, but nobody is going to force you to take advantage of them. you really do have to take that extra initiative to engage with them, to respond to their emails, to attend their sessions, to make sure that you're taking full advantage of all of that they're offering. Like Dr. Shitu just said, one of his students knocked on his door. That's not something that anyone was going to make that student do, but that student got a great opportunity by taking that extra initiative, that extra step to do that himself. Our career services.
Let me share my screen for a second. Kat. Kat is frozen. Mr. Bass, is she frozen?
Please go ahead.
Okay, let me continue. So I'm gonna share a few pictures, and I'll talk about those people in the pictures. If I share screen 2 right here. So you see, I don't know what to see on what I'm sharing now.
We can see acknowledgements group in 2021.
Exactly. So this was my group in 2021. Right here is Fanjuan Du, who did his master's and left. He did some research with me. Here is Tianyi Wang. Tianyi is defending his dissertation this semester. Right here is Weijie Pan. He's also defending his PhD this semester. They both started in 2021 fall. Right here is Dor Ersh Bagai. Dor graduated in 2019. 2020. He graduated in 2020, PhD. Right here, he graduated in 2022. Sorry, 2022 is PhD. Myself. Here is Langarika, Javier Langarika, and Christian. They were master's degree students. They worked on a project with me. And here is Olawale Ogunride. Olawale Ogunride actually works for Chevron right now. He's a Chevron employee. He did his PhD studies here as well. Now, all the master's degree students you see in this picture, they came knocking on the door, willing to work on projects. And when you work on projects, you usually don't do it for free. It's almost like you are working, you are engaged, and you are paid an hourly due. And that is the idea behind all of that. That was 2021. Let's fast forward just to late last year, fall of 2024. These are the people I mentioned earlier. Here is Pan and Tianyi that you saw in the previous picture. They are defending their doctoral degree this semester. Here is Isha. Isha is a new doctoral degree student. Isha Vivesh, she just started. Here is Paul Asamoah. Paul Asamoah just got a paper accepted in energy and buildings. We've been working together since the fall of 2024. Myself, here is Etienne Effiong. Effiong's paper is under review. Here is Mobolaji, who is working on this asset biomedical tracking device technology I just spoke about. Here is Faisal, who is a master's degree student as well. Here is Ibrahim, who is a master's degree student and is thinking of actually staying back for his doctoral degree. And he also has a paper under review. And here is Joel. Joel is also working on a paper. And here is Fahad Al-Mutairi, another PhD student. Again, I can go on and show you the opportunities of students we have worked with. In the past, here is my very first PhD student, Ilka Deluke, who works for the World Bank and is an associate at Charles Rivers Associate. That is Wale that works at Chevron. This is Dor, who is at the Northwest Power and Conservation Council. And then this is Weijie Pan, who is a current PhD student, who is defending this semester, and some other faculty members. So again, I can go on and tell you about the opportunities that are bound. Ladies and gentlemen, this is Washington, D.C. This is the capital of the United States of America. Everything happens around here. The whole time we've been on this session, I could have walked to the White House and back at least 4 or 5 times. Those are the opportunities that this environment offers.
Thank you very much, Doctor. Is Catherine still on? I would love her to give the final word. Okay, I don't think she's on. So, Doctor, can you give the final piece of advice before we draw the session to a close?
So I'll tell you this. I see other questions we couldn't get to. Shoot an email to admissions@gwu.edu, engineering@gw.edu. They will answer. There's somebody already there waiting to answer your questions. That's one thing I'll say if you have any other questions. Number 2 is If you haven't taken the step, then nothing happens. I strongly encourage you to take the step. Number 3, if you've gotten any form of funding, be it 25% off, 50% off, whatever the level is, take it. Take it. You are only investing in your career. As you can tell, I was once like you. So who says that 5, 6, 7, 8 years from now, you won't be me? That's the point I'm trying to. If you don't take that first step, then you cannot really see what the possibilities are. Don't be daunted by social geopolitical events. Focus strictly on your objective. What do you want to achieve? What contributions do you want to make? How do you want to advance your career? When you find yourself in this environment, you will always figure your way out. I encourage you to take advantage of the opportunity that these students I showed to you, myself, and others before us have taken advantage of. That's how I would like to end. Again, shoot email to engineering@gw.edu if you have any additional questions that we really didn't get to answering today. Again, I encourage you, apply, and if you have any form of funding, accept the offer. And I'll tell you, GW is unique in so many different respects. And I'll encourage you to come to GW because of the tremendous opportunities that are abound in this environment. Thank you very much.
Thank you very much, Doctor. Thank you, Dr. Shitu. Thank you so much, everyone. Thank you for joining us. We wish we could take all your questions and answers and answer them on this call, but unfortunately, we will have to round up now. But please send an email if you still have any questions to engineering@gwe.edu or support info@seedglobaleducation.com. And we are going to make sure we answer those questions as quickly as possible and as detailed as possible. Thank you for joining us. Please ensure you take advantage of the application fee waiver code in the chat. Also visit the link to apply for any of the 19 awards by Seed Global on the application portal. And please make sure you complete your application before the deadline. The deadlines for round 4 is very, very close. Please complete your applications before then so that you can join this amazing schools program before for 2025, for this 2025 session. Thank you very much for joining us, and we really hope that you got a lot of value from this session, and we look forward to seeing you on more sessions like this in the coming future. So look out for the recording of this video, this session on the YouTube page tomorrow, and we'll see you on more masterclasses like this. Thank you for joining us. Thank you for spending time. And
thank you very much, Mr. Kari. Thank you, Mr. Jojo. Thanks,
thank
everyone.
you very much, Doctor. Thank you, everyone. And bye for now.